Fourth chemical mediator is the nitric oxide. Nitric oxide is a soluble product and it causes the vasodilation. Nitric oxide is a soluble product and causes the vasodilation, that is endothelium derived relaxing factors. Endothelium, macrophage or the neuron or in the brain. In the endothelium or the macrophage or in the neurons in the brain, there is the oxygen combined with the L-arginine and the NADPH with the help of the nitric oxide synthase enzyme to form the nitric oxide. There is the three isoform of the nitric oxide is there. Is the type 1, 2 and the 3. And the type 1 is a neuronal, then inducible and then endothelial. Type 1 is a neuronal, type 2 is the inducible and the type 3 is the endothelial nitric oxide synthase. Action of the nitric oxide is through the paracrine effect. They causes the vasodilation by the relaxing the vascular smooth muscles. Also causes the control of the inflammatory systems or the inflammatory response. They control the inflammatory response by the inhibiting the WBC recruitment and the adhesion. And causes the decrease the platelet adhesion, aggregation and the degranulation, also microbial activity. Next on the fifth chemical mediator is arachidonic acid derived metabolites. In the injured tissue, the cell membrane phospholipids by the enzyme phospholipase from the arachidonic acids. Arachidonic acids undergo two pathways, एक तो cyclooxygenase pathway and the second is the lipoxygenase pathway. In the cyclooxygenase pathway, by the enzyme cyclooxygenase, which is inhibited by the aspirin and the indomethacin, arachidonic acid will form the thromboxane. Thromboxane causes the vasoconstriction and the platelet aggregation. Prostaglandin D and the prostaglandin E2 causes vasodilation and the vascular permeability. And the prostacyclin PGI2 causes vasodilatation, inhibition of the platelet aggregation. Prostacyclin causes the vasodilatation and the inhibition of the platelet aggregation. D2 and the E2 causes the vasodilatation and the vascular permeability. Thromboxane A2 causes the vasoconstriction and they stimulate the platelet aggregation, so that easier to the platelet plaque formation. Or the arachidonic undergo the lipoxygenase pathway by the 5-lipoxygenase enzyme. It will form the 5-HPETP and which will form the 5-HETE. 5-HPTE form the leukotriene A4, which give the leukotriene B4, leukotriene C4, D4 and the E4. Leukotriene B4 along with the 5-HETE causes the chemotaxis. Leukotriene C4D and the E4 causes the vasoconstriction and the bronchospasm, increase the vascular permeability. Causes the bronchospasm, vasoconstriction, increase the vascular permeability. And in the lipoxygenase pathway also the lipoxygen will form and will inhibit the neutrophil adhesion and the chemotaxis, Here, phospholipase in this reaction is inhibited by the corticosteroid and cyclooxygenase is inhibited by the aspirin or the indomethacin.